Good morning, prominent speakers, distinguished guests, colleagues, students, and friends. I am Zoe Chan, a Year 3 student in the Global Health and Development Program here at the School of Public Health, the University of Hong Kong. On behalf of the school, it is my great pleasure to welcome you to the HKU SPH Public Health Forum 2026 on Public Health, Challenges, Opportunities, and Innovations. The school would like to take this opportunity to explore pressing health issues and emerging threats while highlighting innovative solutions, collaborative efforts, and policy development. To begin, here is an overview of today's program. We will start with a keynote speech titled, Innovating the Future of Health. This will be followed by our first plenary session, Exploring Opportunities for Interdisciplinary Collaboration in Public Health. A vision for the next 5 to 10 years. During the intermission, you are encouraged to visit the student poster session in the foyer, featuring 44 poster submissions from our RPG students this year. After that, we will reconvene for a second plenary on Public Health Research and Education at HKU School of Public Health, Challenges and Opportunities in the next 5 to 10 years. Finally, we will present the Best Student Poster Award and host a special event, inaugural induction ceremony for Zeta Alpha Delta Omega chapter of the School of Public Health. We warmly invite you to stay and celebrate this special moment with our inductees. Here I share with you 2 QR codes. The one on your left will direct you to the forum webpage with information on today's program, speaker's bio, and presentation abstracts. The one on your right allows you to leave your questions for the speakers. We will be selecting from these submissions during the Q&A session. You can also leave your questions under the Q&A tab on the forum webpage. Without further ado, please join me in welcoming our honorable guest, Dr. Ronald Lam, Director of Health, Department of Health, the Government of the Hong Kong Special Administrative Region of the People's Republic of China, to deliver the welcoming remarks. Dr. Lam, please.
Professor C.S. Lau, Professor David Bishai, Professor Gilbert Leung, Dr. Lu, and distinguished guests, ladies and gentlemen. Good morning and a very warm welcome to the Public Health Forum 2026. It's really a homecoming for me because I was the first cohort of the Masters of Public Health program. And at that time, it was called the Masters of Medical Sciences bracket with specializations in public health, a very long title. And I was seconded by the Department of Health to work as an honorary research assistant. I remember it was the title given to me at that time. In year 2000, worked for almost a year under Professor Anthony Hadley and also Professor T.H. Lam that time. And I remember alongside with Professor Sophia Chen and also Gabriel. So it's really heartwarming coming back and to share and to learn from the School of Public Health. Well, today's topic is challenges, opportunities, and innovations. When I saw the theme today, I really do feel that sums up all my Monday mornings. And actually, we are proud of our achievements in Hong Kong because we have a very resilient healthcare system and we have a very long life expectancy that ranks top globally. We are aware that there are a lot of challenges lying ahead of us, like aging population, mental health, inequality, and also our healthcare system actually is feeling a very large strain. And the ever-present shadow of pandemics as well. So tackling these challenges cannot rely on our old tools, and that's why we have to focus on innovations today. I think innovation is not just a buzzword, but it's a gutsy, real, why not type of innovation. And we need to be smarter, faster, and be creative. So whether it's using AI to predict the next pandemics or use apps to manage chronic diseases or precision medicine and so forth. Innovation actually is our best shot at turning the challenges into opportunities. And I would like to add an important thought from my capacity as a regulator. I think innovation really requires also regulation. It's the regulatory framework that actually ensures all the new ideas are safe, equitable, and sustainable. And as someone myself, as the personally liable and responsible for helping to frame the regulatory, the overall framework, I see regulation is not a barrier, but actually guardrails for propelling the innovation forward. And so it comes without saying that the best innovation work with the system to protect and serve our community. And that's why the Department of Health is launching the Center for Medical Products this year, which consolidate all the regulatory functions regarding pharmaceutical products, medical devices, and so forth. And we are submitting the bill for the regulation of medical devices within this year as well. And there are several other initiatives that would try to make the Hong Kong stand out as the global hub for medical and health innovation. So I look forward to your support and contribution in the months to come. And actually, Hong Kong U are part of being part of the alumni. I think it is no better place than to start the conversation on innovation here. Because for over a century, I think Hong Kong U is not just teaching public health, but it's defining it. So from SARS to COVID-19, actually, the School of Public Health, the government worked with the school as the sort of intellectual emergency service as well. So the research of School of Public Health just doesn't play in the journals, but it translates to actions and shapes our policies. And with the initiatives like the Institute of Cancer Care, the Hong Kong Jockey Club of Global Health Institute, and also the Primary Healthcare Academy and the Hong Kong U Pasteur Poll as a research hub, and with all these new structures and all research opportunities, I think the School of Public Health is not just keeping up, but it's building up what's the next, right? So I would like to emphasize that innovation and regulation both thrive on collaboration as well. So as a government, we can set the stage, but we also rely on Hong Kong U's brilliance, the frontline workers' dedication, and also your trust as well, or all of you sitting here, your disruptive ideas to give us, to help to make Hong Kong a healthier place. And last but not least, let me remind you also that we have to work together within the context of Greater Bay Area as well, because this cannot happen alone. And I would like to thank also the School of Public Health for giving us this great platform for bringing us together, academics, leaders, experts, and future healthcare professionals as well. And I really hope this forum not just happens by sharing our expertise, but also we can have some friendly arguments, perhaps find collaborators, and even hatch some plans that are actionable. Okay, thank you so much.
Thank you, Dr. Lam, for the welcoming remarks. Please be seated. May I now invite Professor C.S. Lau, Dean of the LKS Faculty of Medicine, to deliver the welcoming remarks. Professor Lau, please.
Thank you very much. And Dr. Ronald Lam, Director of Health. Dr. Michael Lu, our keynote speaker from UC Berkeley. I see many colleagues actually from both the faculty, as well as I note a number of you actually from the National Health Commissions of the Chinese mainland. Distinguished guests, friends, and staff, colleagues, and students. Thank you very much for asking me to come to speak to you here. This is the third time, actually, I'm attending this Public Health Forum as a Dean. And thanks not only for inviting me to come to speak, but also thanks to the School of Public Health for organizing this annual flagship event of the school. This is very important. In all of the 3 forums that I have been, you actually invite not only people who know about public health, but people who know about the rest of health and health sciences, etc., exemplifying actually the importance of interdisciplinary, multidisciplinary approach to health. Now, I keep telling people that actually in many of my welcoming speech, there are usually just 2 messages, okay? One is thank you and one is apology. And I've already done my first thank you. I have a few more thank you later on. Let me go back to my apologies to start with. This room is very cold, so my apology. This is not a very good policy for controlling the respiratory viruses like the flu that is really circling around in Hong Kong right now. My second apology is actually to all of you, and particularly to Dr. Lu, that unfortunately there are many events in the faculty on Saturday mornings. So I have to sort of leave immediately after this to also say hello to my colleagues from the Department of Medicine. There is a medical research conference, and I'm a member of the department, so I have to go, otherwise I might get fired. Coming back to thanking all of you. Besides, this forum, I would like to indeed thank David for organizing, this forum so expertly. And over the last 3 years, just looking at the themes of the forum, from 2024, when we actually looked at, the past, the present, and the glimpse of the future of public health, I could actually see how he was actually trying to, steer the school in a new direction. And of course, last year, actually, we looked at how to translate science to better health. And this year, we're looking really into the future, looking at all of the challenges and also opportunities and how innovations can actually improve health. And Dr. Ronald Lam has already highlighted how important it is that we should and must continue to innovate. And one of the features of today's forum, and I note, is there's the full session, although it's during intermission, which is even better, then you can speak freely and ask questions freely. It's a full session for our students, and I think this is important, engaging our young, engaging our next generation of public health specialists is the key way to go. So I thank you all very much, and I thank you, David. Each time I speak here, I will tell you how much actually I support public health and how much I wanted to be a public health specialist had I actually got another chance to choose my career again. Too late now, I can't change my career. I'm a physician, but the support for public health from the faculty actually is, I think, evidenced by the fact that over the last 2 years, we really have tried to engage ourselves in the sort of world stage as such. And I also thank, of course, David and the school for supporting the faculty in getting ourselves as a member of the World Health Summit Academic Alliance. And almost immediately after we became a member, we were actually endorsed by the executive committee to run the next regional meeting in Hong Kong next year, around sort of April, May of next year. The reason being, of course, I believe it is important that we engage, world leaders, world policymakers, as well as, of course, experts in public health in improving our sort of health development in this region and in the rest of the world. So it so happens that, in fact, the next year is the celebration of the faculty's 140th anniversary. So the World Health Summit regional meeting to be held, likely in May, will be one of the key events of our celebrations. So I look forward to seeing many of you back, not here, likely to be in the convention center, and to help and support us celebrating our 140th anniversary and history. And finally, my final thanks is to the whole of the School of Public Health. And David just showed me this book pamphlet from the school, hot off the press, I was told. First couple of pages, not only are there many beautiful pictures, but also, I think, reminding us the successes and the achievements of the school. 23 top 1% researchers out of, I think, I better not, I've forgotten the exact number of how many in the university. I will tell you that has to be more than half, almost half of the number of top 1% highly cited researchers of the whole university. And not only many top cited researchers, but also we are supposed to be the first #1 School of Public Health in Asia, according to the Shanghai ranking. So congratulations, School of Public Health, and thank you so much, for all the good work, and it is how we all grow together, and may you continue to be successful, and thank you again for the public forum, and I hope you have a very good day. Thank you.
Thank you, Professor Lau, for the welcoming remarks. Please remain on stage. Now it's time for a group photo. May I invite our honorable guests, Dr. Ronald Lam, Professor David Bishai, Director of the School of Public Health, and all our prominent speakers and moderators to join us on stage, please. Thank you, everyone. You may return to your seats. Professor Bishai, please remain on stage to introduce our keynote speaker. Professor Bishai, please.
Thank you, everybody. It's my privilege to introduce our speaker. I want to acknowledge our guest, Dr. Ronald Lam, C.S. Lau, Dr. Edmund Ma, Dr. Mack, and Dr. Macau for being with us, and all of our faculty, students, our guests from the National Health Commission. We're so glad that you could be with us. Our theme is challenges, opportunities, and innovations. And for a topic like this, we wanted to invite a guide who has mastered all three of these. And I'm very grateful to Michael Chan, the organizing committee. I get no credit for this brilliant decision of the organizing committee. Thank you, Michael, for finding our guide today. Professor Michael Liu is a distinguished physician, scientist, educator. He is an epidemiologist with a master's in public health from UC Berkeley. He's trained as a physician at UC San Francisco. And he was a professor of obstetrics and gynecology, a practicing obstetrician, delivered thousands of babies. Out there are people who owe their lives to Dr. Michael Liu for coming into this world safely. He's led at the highest levels. He was the director of America's Maternal and Child Health Bureau, one of our most important agencies taking care of mothers and children. He's been recognized as a fellow of the National Academy of Medicine, and he received one of America's highest, most distinguished prizes from the U.S. Department of Health and Human Services, which was the Hubert H. Humphrey Service to America Award. But why is he our guide today? Well, he has been able to meet challenges, both as a doctor and as a scientist. He had to help move our government to seize new opportunities as America realized that it was having disparities in maternal health and in child survival, and to address policies that could correct those disparities. And now, as the dean of the Berkeley School of Public Health, he's embraced innovation, helping his faculty as well as faculty around America bring those innovations to scale and out to the marketplace. So we're so glad that our theme has met its master, and I invite you to listen very carefully to the remarks of Professor Michael Liu.
Thank you, Professor Bishai, for introducing the keynote speaker. Please be seated. We will now proceed to the keynote speech of today's forum, a presentation titled Innovating the Future of Health. May I now invite Dr. Michael Liu, Dean of School of Public Health, University of California, Berkeley, to deliver the keynote speech. Dr. Liu, please.
Good morning. Thank you, David, for that very generous introduction. It's so great to be back at HKU, and I'm deeply honored to be invited to keynote this public health forum. So I was asked to talk about how Berkeley Public Health is innovating the future of public health. But before I do that, let me just kind of raise this question. To what purpose is the university? Well, we educate students, we do research, we serve the public. But to what end? To what purpose? I would argue that the primary purpose of the university is to help solve society's biggest problems. And we do that through the research we do, the students we educate, and the societal change that we try to bring about. And we got big problems to solve in public health, right? Globally, we're fighting the kind of worsening climate change, growing pandemic threats, rising chronic diseases, and deepening social inequality. And in my country, in the US, we're fighting the spread of misinformation, disinformation, growing attacks on science, on higher education, on public health itself, and increasing division and polarization both in our country and around the world at a time when nations around the world should be coming together to tackle these big problems. So how many of you think that public health is winning the fight? We're fighting a losing battle on all of these fronts. So if our job is to solve big problems for society, doing more of the same isn't going to help us get there. So we got to start doing things differently. We have to research differently, we have to educate differently, and we have to try to change society differently. So I'm going to share in the next 15 minutes or so what Berkeley Public Health is beginning to trying to do differently in all of these three areas. So starting with researching differently. So why do we need to research differently? Well, I think much of the research in public health is still too incremental and too siloed. Ezra Klein actually talked about this in his book, Abundance, about this incrementalism, and partly that's driven by the way NIH and NSF have traditionally funded research that tended to favor established investigators and projects that are safe and incremental. And despite decades of talking about team science, convergent science, transdisciplinary collaboration, so much of our research in public health still takes place in silos. And some of this is structural, right? Because universities are organized along verticals. So in School of Public Health, we have epidemiology, biostatistics, health policy and management. In medical school, you have verticals like nephrology, ophthalmology, pediatrics. It's actually really, really hard to solve big societal problems by working in these vertical silos. So instead of vertical silos, what if we were to create a horizontal platform that brings the entire campus together to try to solve these health problems? So that's the idea behind Berkeley Health. And I'll give you a little bit of background on this. So 3 years ago, John Doerr, a big VC, in the United States gave Stanford $1.1 billion to create the Doerr School of Sustainability. And the idea is, can you actually harness all of that intellectual firepower across the Stanford campus to try to come up with some climate solutions that are scalable for the planet? Well, over the past 6 months, my chancellor and I have been in conversation with a donor with similar capacity and conviction that wanted to help Berkeley do something similar around health. Can we harness the intellectual firepower of the #1 public university in America to tackle some of these big health challenges? And so we knew this wasn't going to be just another school, right? Because we want this to be truly transdisciplinary. Initially, we were going to create a new college. It turns out several other colleges on Berkeley campus wanted to be part of this. The College of Engineering, the College of Chemistry, the College of Data Science. So now we're going to call it a health campus. And this will be like a health campus like no other health campuses. Historically, health campuses have medical schools and pharmacy schools, nursing schools, public health schools. Our health campus would actually have some of the top-ranked schools of biology and chemistry, data science, engineering, public health, public policy, law, business, so forth. 15 schools coming together to tackle some of the big health challenges that our society faces. Okay? And instead of just doing incremental silo research, we're asking all of these schools to come together to take bold, transformative, what we call moonshots, to tackle these problems. And instead of focusing on the next targets, the next billion-dollar drugs, the next late-stage rescue care, we're going to be focusing on the true drivers of health. And the last thing I'll say about this, and certainly this is still a work in progress, and hopefully I'll come back next year and tell you more about how this is going. People ask me, well, how can you have a health campus at Berkeley without a medical school and university hospitals? I said, well, we have UCSF right across the bay. If we need clinical sites, we can always partner with UCSF. But as all of you know, so much of health actually occurs outside of clinics and hospitals, and that's why having public health drive something like this changes the conversation about the future of health. The second is to educate differently. So, as probably for you and for our students, most students come into public health, especially come into Berkeley Public Health, because they want to help change the world. They want to make the world a better place. But unfortunately, most schools of public health don't teach change-making very well. I know, because when I was working in the Obama administration, I got to work with students, with some super brilliant students from some of the top-ranked schools of public health in the United States. Right? And they can do a biostatistical analysis like nobody's business, and yet there were still things that were missing from their toolkits that prevented them from being effective change makers in the world. So over the last few years, we developed this new change maker curriculum. We now have developed 12 new micro courses that are focusing on change-making competencies starting with the 3 C's, right? Communication, collaboration, and critical thinking, and I'll add a 4th C, which is community engagement. Then you have strategic thinking, systems thinking, human-centered design thinking, innovation, entrepreneurship, policy advocacy, leading change. The idea is that by the time our students graduate, they will graduate with not only a world-class education in the core public health sciences, but the knowledge, the tools, the skills they need to go out and help change the world. Now, the third thing is about changing society differently, right? So historically, universities have 2 missions, research and education. But increasingly, educators are talking about a third mission of the university, that universities exist not only for the education of students or generation of knowledge, but for betterment of our communities and society and the planet. We call that third mission social impact. And last year, when I was here, I talked about the social impact platform that we're building at Berkeley to help elevate our social impact, to engage with community, to help faculty and students engage with community or accelerate policy change. But today I want to talk about a different kind of social impact. How we are working to accelerate the translation of discoveries and innovation into real-world impact through our innovation and entrepreneurship work. But before I do that, let me just ask you this question. Which university ranks #1 in the world for generating venture-backed startups? What do you think? Harvard, MIT, Stanford, UPenn, Berkeley. How many of you think Harvard? Stanford? MIT? UPenn? Berkeley? Okay, those of you who raise your hands, you're good test takers. Right, because you know where I'm going with this, right? So it's Berkeley, right? So as of kind of last year, Berkeley has founded over 1,600 companies, and these are venture-backed companies compared to Stanford, which is, sits at below 1,400. Who knew, right? Like, that's certainly not how any of us think about Berkeley, right? When you hear of Berkeley, what do you think of? Free speech, right? We're the birthplace of free speech. Anti-war, we were the epicenter of counterculture, right? Maybe even a little bit of anti-capitalism, right? We're the epicenter of the radical left. How did we go from that to becoming a global powerhouse in innovation and entrepreneurship? How did that happen? Well, certainly not by accident. This has been decades in the making, but it really happened especially in the past decade. So I want to call your attention to this new book that just came out called Startup Campus. I actually brought 2 copies of this, one copy for the School of Medicine and another copy for the School of Public Health Library, which really chronicled the history of how Berkeley became this powerhouse of innovation and entrepreneurship. Now, I don't have time to go over everything, but I'm just going to highlight 7 strategies that Berkeley used and other universities can use to really become that epicenter for innovation. So the first strategy was around culture. You have to cultivate a culture for innovation and entrepreneurship. And that's especially hard at a place like Berkeley, right? Even when I became dean 7 years ago, there were still faculty that really view industry as dirty money and I&E as going over to the dark side. Right? But that has, over kind of this last decade, really changed. And some of that is having these like intentional programs that are trying to change the culture. Programs like our Baker Fellowship. Okay? So the Baker Fellowship was actually started about 12, 13 years ago to help faculty commercialize their discoveries. Now, so what did faculty get? Actually not that much, right? It's about $100,000 a year for 3 years. And they got about $300,000 to help them with marketing, prototyping, commercialization. And they have access to some graduate and undergraduate student help. That's it. It's not that much, but it was enough to attract some top scientists to become fellows. So over the last decade or so, we have about 82 Baker Fellows that have turned out more than 20 venture-backed companies. But more importantly, each year, hundreds of faculty actually competed to be Baker Fellow. And I think that generated the kind of momentum, excitement, legitimacy, and value around innovation and entrepreneurship. Second is infrastructure. I would even call that ecosystem that really helps support faculty and students starting kind of new companies. So at Berkeley Public Health, it's one organization, and Skydeck, which is ranked, top-ranked university accelerator, is another organization. How many organizations in the entire UC Berkeley ecosystem that works on innovation entrepreneurship? What do you think? It's actually over 100. So we're not talking about creating one office, one incubator, one accelerator, but okay, we're really talking about entire ecosystem, and the pace of these organizations has really accelerated. It's really bottom up. Right? 7 years ago, when I arrived at Berkeley Public Health, there was nothing going on. But with the support of this ecosystem, I was able to create the kind of work that we're doing in Berkeley Public Health around innovation and entrepreneurship. And so it's about creating an entire ecosystem to supporting this work. The third thing is about expertise, right? Bringing the right people with the right skills who knows both academia and industry to help bridge that valley of death from discovery to market. So early on, we brought in the expertise for our technology transfer, and they did a great deal in terms of helping faculty license. And one of the things that they actually did, because we know that early on in the life of a startup company, especially in life of professors, you don't have the money to pay for licensing your discovery, right? So what Berkeley does, we actually dial back on the licensing fee in exchange for some equity in the company. Not a whole lot, maybe 1 or 2%, but 1 or 2% of a $10 billion company like Databricks is actually a lot of money, and this has now become a really important revenue stream for the university. And it's important because we're a public university, right? With state funding declining, with federal funding becoming more unpredictable, and there's only so much you want to do to raise tuition on students in a public university. Yeah, starting thinking innovation, entrepreneurship is a way that we're trying to finance the preeminence of the future preeminence of a public university. Fourth is around leadership. And I think we really got lucky in the last 10 years. We had our former provost, Paul Alivisatos, who is now the president of the University of Chicago, and then Rich Lyons, which are our current chancellor, former dean of the business school, and Berkeley's first chief innovation and entrepreneurship officer. And the two of them, under their leadership, innovation and entrepreneurship really thrived. The fifth is inclusivity, right? If I just talk about innovation and entrepreneurship, I'd lose half of the campus. Right? The arts, the humanities, the social sciences. But by branding it as change makers, right? And that's that's the genius of our current chancellor, Rich Lyons. Not everybody wants to be an entrepreneur, but everybody wants to be a change maker. 6 is around fundamental research. You got to be able to address the fear of some faculty that somehow that INE is going to displace fundamental research. It's not an either or, it's really a both and. A case in point is Jennifer Doudna, the Nobel laureate for her work in CRISPR. Since winning the Nobel Prize, She has founded 4 companies, and at least one of them have become a billion-dollar company, most of them in partnership with her students. That hasn't made her any lesser a researcher. In fact, what she says is that that kind of work in the real world has really feeds back to drive some of the fundamental research that she's doing right now. And last thing I'll say is around partnership, and that's what Berkeley has been able to do, partnering with laboratories and the Chamber of Commerce at Berkeley to create a whole Berkeley innovation cluster. And since my time is up, I'll just say this kind of one last thing. And we're actually taking this partnership global so next month I'm going to be hosting the 3rd annual JP Morgan Healthcare Conference in Taipei. Many of you may know JP Morgan Healthcare as the world's kind of large stage for biotech and healthcare investment. So we brought that to Asia 3 years ago. People say, well, if you have one in San Francisco every year, why are you having another one in Asia? Right? If you've ever been to the Asia track of the JP Morgan San Francisco, it's pretty pathetic, right? So I was there last week, and you got these like brilliant companies from Asia presenting on stage, and there are 3 people in the audience listening to it. So by creating a stage and bringing some of the top companies and top investors from around the world, we get to showcase all the incredible capabilities that Asia has to offer. I know during one of the JP Morgan conferences, somebody asked me, what is a public health dean doing hosting a JP Morgan conference? It's really an investment conference. And my answer is that if there's something I can do to help accelerate, bring in life-saving therapeutics of disease-preventing diagnostics to market by facilitating this kind of collaboration across sectors, across disciplines, and even across continent, I think that should be the work of public health as well. So I hope I gave you a flavor of what we're doing at Berkeley Public Health to innovate the future of public health. And whether that's by launching a health campus like no other health campuses, whether it's by starting, training the next generation of health change makers, or by making sure that public health not only have a voice, but is actually changing and driving the conversation in the world's largest stage for biotech and healthcare investment that are shaping the future of health. Because I truly believe that health, that future is going to be shaped by people who can build bridges, build systems, who knows how to innovate and collaborate. And I believe public health is better positioned than anybody else in terms of shaping that future of health. So thank you very much.
Thank you, Dr. Liu, for your sharing. Please remain on stage. We will now proceed to the Q&A session. Audience may scan the QR code on the screen to pose a question. Professor Gilberto Leung, Director of School of Clinical Medicine, Co-Director of Center for Medical Ethics and Law, and Zhang Wenheng Professor in Clinical Neuroscience, LKS Faculty of Medicine, HKU, will be the moderator of the Q&A session. May I now invite Professor Leung to the stage, please.
First of all, if you get the microphone, my pleasure to be here. You can't find anyone who knows so little as me about public health because I'm a neurosurgeon. But it's a pleasure for me to moderate this session with Dr. Liu because we actually are both surgeons in a way. So any questions from the audience, I would read them out. Can you bring JP Morgan conference to Hong Kong?
Well, thank you for throwing me a softball.
Me.
I heard I was getting questioned by a neurosurgeon. I got really scared. But yeah, no, I think the original vision of JP Morgan was that it needs to be truly regional, right? If this is only a Taiwan thing, it's going to be too small a market. Right now, our donor is Taiwanese, and so that's why we've been hosting in Taiwan. If someone in the audience had the capacity that wants to bring JP Morgan here, please talk to me afterwards.
Well, I'm sure many people would be interested in that, but may not be familiar with the idea of a School of Public Health working with JP Morgan. Can you give us some examples as to what kind of projects that you are talking about?
Yeah, so it is actually very unusual for a School of Public Health to be in JP Morgan. In fact, we hosted an event at JP Morgan San Francisco last week. It's actually, JP Morgan has been in San Francisco for 40 years. It's been in our backyard. It was the first event that we ever hosted. And I think it's the first event that any schools of public health has ever hosted. And the reason we wanted to be there is because we want to change the conversation. I was told that Jamie Dimon, the CEO of JP Morgan, gave the opening speech. It took him about 45 minutes at a healthcare conference to actually start talking about healthcare, right? When you hold an event like we did the School of Public Health, you worry that you throw a party but nobody show up, right? It was sold out within hours. The room was packed. We had hundreds of people. These are investors and innovators. But it clearly demonstrates a desire to have a different conversation, one that's like centered around healthcare. And we talked about longevity and beyond longevity, right? So instead of having a conversation centered around the next targets, the next drug, the next valuation, we talked about the true drivers of health. And I think it was well received, and it's probably started a new tradition at Berkeley Public Health. I think we're resolved to make sure that public health voice is represented every year at the JP Morgan Healthcare Conference in San Francisco.
Do you think that narrative will be different between the two halves of the world? Forgive the saying, but that's the rhetoric that we are facing now. The world is having two hemispheres at least. Whatever is happening in UC Berkeley, do you think it can be replicated or practiced in Asia? Is there a divide, necessarily a divide?
Yeah, there's certainly a divide, and unfortunately, as I mentioned, the divide is getting larger, right? And which is unfortunate, because you think of all the problems that I talked about, and whether it's climate change, whether it's a future pandemic, we need the world to come together, to cooperate and collaborate to solve these problems. And so that's where geopolitics aside, right, we still have a job to do here. And the more of these type of forums that we do, the more we bring people together, put their agenda to the side, and keep our eyes on the prize and get something done in the world, I think that's the job of public health. One of the change maker competencies that I talked about is exactly that, right? Are you able to have a conversation with somebody who disagree with you, and able to talk across differences and still find common ground to find solutions for the world? I think that's going to be really, really important. Again, I think there's nobody more equipped and more qualified to do that than public health leaders. So that's the challenge to all of us, to be able to do that.
Suddenly, about 8 questions popped up, and we have about 50 seconds left. But I'll just have to randomly choose 1 or 2. Forgive me if I
Give me another softball.
Yes. What is your idea of the role of the WHO in a new scenario?
What's my idea, or what's Trump's idea?
Yours first. Yours first.
Yeah, no, I think certainly there's a role for WHO, right? In terms of creating that kind of platform that brings the world together to solve these big problems. There were certainly challenges that the WHO faces, but I think the vision is still an important one, and I think what we need to do is to strengthen it rather than to tear it down.
Maybe one quick one. Investors are looking for return on the investment, mainly money. How can we reshape incentives for research and innovation?
Yeah, the question is how do we incentivize investors to invest in health and not disease, right? I do think there's a lot of money to be made in health, right? But just raise your hand. How many of you want disease? How many of you want health? Let's figure out how to monetize that, right? Because that's how we're going to be able to scale public health. Find creative, innovative ways by which we're going to finance the future of health.
Thank you. Well, as I said, there's still questions popping up, and I'm sure you'll be happy to address them if they approach you during the break and the rest of the day. So with that, I'd like to invite everyone here to thank Dr. Liu for his very, very inspiring talk. Thank you.
Thank you, Dr. Liu, for the illuminating keynote, and thank you, Professor Leung, for moderating. May I now invite Professor Leung to present a token of appreciation to Dr. Liu.
The gift exchange.
This is far more important. Thank you so much.
Thank you, and please be seated. We will now begin our first plenary session, exploring opportunities for interdisciplinary collaboration in public health, a vision for the next 5 to 10 years. May I now invite Professor Maria Zhu, Associate Professor of the School of Public Health, to give us a short introduction. Professor Zhu, please.
Okay. Good morning, everyone. It is my great honor to welcome all of you to this important session. Today, we gather to foster dialogue and strategic thinking about the future of public health, emphasizing the vital role of collaboration. Firstly, I would like to introduce the Guangdong-Hong Kong-Macao University Public Health Alliance. It is under the Guangdong-Hong Kong University Alliance. And this university alliance aims to enhance the regional cooperation and development across higher education institutions in the Greater Bay Area. Since its establishment in year 2019, the Public Health Alliance serves as a collaborative platform uniting leading universities like Yat-sen University, Southern Medical University, the Chinese University of Hong Kong, the University of Hong Kong, and the University of Macau. Its primary goal is to elevate the regional public health research, education, and social services by promoting resource sharing, fostering interdisciplinary research, nurturing talent, and strengthening social health initiatives across this region. Today's session will feature brief institutional presentations from our Alliance members, highlighting their unique research strength, ongoing projects, and collaborative efforts. Our distinguished speakers, Professor Lin Hualiang from Yat-sen University, Professor Shelly from the Chinese University of Hong Kong, and Professor Xiang Yutao from the University of Macau, will bring valuable insights and strategic visions for this dialogue. And following that, we will engage in a dynamic discussion on pressing public health issues or challenges, exploring new opportunities for cross-sector collaboration and innovation. And ultimately, our aim is to inspire continual cooperation among institutions and stakeholders in this region, paving the way for innovative, sustainable solutions that contribute to global health security and health equity. And we look forward to an engaging and fruitful discussion. Thank you.
Thank you, Professor Chu. Please be seated. Next, may I invite Professor Lin Hualiang, Assistant Dean and Chair of Department of Epidemiology, School of Public Health, Yat-sen University. He will now present on the topic Health in Service, Virtue in Scholarship, Inquiry in Depth, and Innovation in Practice. Professor Lin, please.
Thank you. Good morning, everyone. It's my great pleasure to be here to present and introduce our school, especially after the remarkable speak by Professor Michael Lu. It's really impressive. And actually, the purpose, I think, is quite similar. So through my introduction of our school, I think we are also want to do something in the future to educate, to research, and to impact the society differently. So I think, I hope, and we can do that in the future. So I'm Hualiang Lin from School of Public Health, Yat-sen University. Sorry, the screen is different from my own computer. So first, I want to introduce my school. Actually, Yat-sen University is founded by Dr. Yat-sen. Actually, he also studied here in Hong Kong School of Medicine. So we have some close collaboration, connection. Besides that, we also have the alliance, and also in our school, there are some professors and researchers. Actually, they have PhD study in Hong Kong University and also some from Chinese University of Hong Kong. So I think within this alliance, Hong Kong, Macau, and Guangdong Public Health Alliance. So in the future, we can have some more collaborations and some do something together. So our school, within Yat-sen University, we have a long history. It was established, and we have the initial School of Public Health Education in 1956. And after 20 years, we have the first bachelor students. So we all have our 50-year celebration anniversary this year. So here I want to invite all of you to visit our school and to celebrate our 50-year anniversary together. This will be in November this year. So now we are one of the leading schools in public health in mainland China, and also we have some very famous figures and researchers, I think, in the world. So our school, we are located in the North Campus in Yat-sen University. Actually, we have five campuses, and in Guangzhou we have three. The North Campus, which is previously the Yat-sen Medical University. So for the School of Public Health, we have two main buildings, very beautiful campus. And in our school, we have 7 departments, which is quite similar to other school of public health. We have Department of Epidemiology and Medical Statistics, Nutrition, maternal and child health, and environmental and occupational health, and also health, toxicology, and health policy and management. Through this kind of department, we have the very comprehensive education and research in terms of public health and preventive medicine. And we also have some authorized point and key disciplines for bachelor, master, and PhD education and research. And we have some state level and provincial level teaching and research platforms, including the joint international statistical laboratory for the environmental health and public health. And we also have some other local and provincial levels. For example, the last one is in the Hong Kong, Macau, and Guangdong, the Great Bay Engineer and Technology Center, which is also focused on the environmental and health, and also the evaluation of the risk posed by the common environmental environmental factors. And we also have some discipline ranking, as mentioned by the previous one, the Shanghai ranking, and we also have the discipline ranking in our Ministry of Education. In both of the ranking, School of Public Health of Sun Yat-sen University are all ranking in the first level, the level A. We only have 5 universities in this A level. Now, this is a brief introduction of our school, and the next I will introduce our faculty and students. So we have more than 130 staff and faculties. Most of them are professors or associate professors, and they are located in the mentioned 7 departments, doing some research and education. And we also have, each year we have about 100 undergraduate students, and then we have more than 200 master students and 40 or 50 PhD students. So here I want to say that we really want to establish some connections, some collaborations with some universities to have this kind of student exchange and young research training programs. So next I will mainly introduce our main research areas. We have several research areas in our school, including the diet and nutrition and chronic diseases. And we have the environmental and occupational health, the exposure and health study center. And we also have some important infectious disease, the risk model, and also prediction and intervention, this kind of key research areas. So I will introduce the 3 important ones. The first one is diet and nutrition and non-communicable chronic diseases prevention. So here we have provincial, Guangdong Provincial Key Laboratory in Nutrition and Diet and Health, this kind of platform. And we also established a large cohort in South China, including more than 100,000 community-based participants in Guangdong, Hainan, Fujian, Yunnan, about 4 or 5 provinces. So the cohort has been followed up for more than, I think it's 6 or to 8 years. It's a large cohort. Based on this cohort, one team in our school is doing some study on nutrition and also dietary pattern researchers. One interesting study by this team is they collaborated with in other cohort in China, to examine the different dietary style, different diet patterns. China is so diverse and so huge country. We have diverse dietary patterns. So for the health effect, so which dietary pattern is better, is protective for health and for different diseases. They have this kind of comprehensive and systematic study and found some interesting studies, including the different dietary pattern can be have different health effect. Some may be protective for some diseases, some may not. And we provided some recommendations for the different patterns to have the better health effect. And we, in South China, this team also established, proposed Lean dietary pattern, also South China pattern, which is one of the best diet pattern in China, which is quite protective to cardiovascular disease and also some chronic diseases. So they have also published some important findings in the international paper journals, including the Nature Food or Cell Metabolism, this kind of circulation. Another one is environmental and occupational exposure and human health, which I'm working in this area. We are examining the different environmental factors and human health. We based on some important platforms, including the International Joint Laboratory of Environmental and Health, which is a key laboratory under the Ministry of Education of China. So we are examining the short-term and the long-term health effect of the environmental exposures, including air pollution and also climate change. And based on these researchers, we are working as a committee member in the WHO air quality guidelines and provided some evidence from China to revise the WHO's air quality guidelines. And we also working on the, based on our findings and also some evidence in Chinese population to have the national and localized air quality and some environmental quality guidelines or the standards. Now, another one is the disease modeling for the important infectious diseases, including the foodborne, waterborne, and mosquito or vector-borne diseases. We, based on the important environment and the disease interaction, we established this kind of disease transmission model and to predict the potential transmission of the disease and also to evaluate some important intervention measures or strategies, including one of the important is malaria. We have evaluated in Yunnan the transborder transmission risk of the malaria and how we can reduce the transmission risk of the disease. And this research has been published in BMJ recently. So based on these researchers, we have established a few important cohorts, including just mentioned the South China cohort. And also in Guangzhou, we also have a Guangzhou longitudinal old adults cohort, which included 700,000 adults in Guangzhou, and also some multi-omic studies by another group. And we also have Guangzhou Biobank, which is established with Hong Kong U School of Public Health about 20 years ago, and is still ongoing. So during the past year, we have awarded some important findings, including the international and national levels. So this is kind of, and we also have some collaborations internationally and regional and locally. So here I want to say that in the future, our school wants to establish more collaborations with all of you in student exchange and also some research areas. So this is my presentation. Thank you.
Thank you, Professor Lin, for your sharing. Please be seated. Now may I invite Professor Shelly Tse, Associate Director in Mainland Affairs and Professor, the Jockey Club School of Public Health and Primary Care, the Chinese University of Hong Kong. Her topic is an overview of the Jockey Club School of Public Health and Primary Care, past, present, and future perspectives. Professor Tse, please.
First of all, I would like to thank Professor David Bishar for your kind invitation, and Professor Dr. Ronald Lam, Professor Leo Pun, dear friends and colleagues, good morning. I'm actually going to present a topic which is about an overview of the Jockey Club School of Public Health and primary care, the past, present, and future perspectives on behalf of our school director, Professor Samuel Wang. The Chinese University was founded in 1963, and the Faculty of Medicine, we say the CU Medicine, was established in 1981. Our CU Medicine actually provides one of the best medical educations in the world. The Jockey Club School of Public Health and Primary Care is one of the 5 schools of the CU Medicine. It is the first and only tertiary institutions in Hong Kong that integrates the 2 major disciplines of public health and primary care in teaching and research. The milestone of our school public health actually was established in 1981. At that time, the name, which is only the department. So we have the Department of Community Medicine. And then in 1989, the CM, actually Community Medicine, was renamed as the Department of Community Family Medicine. And in 1996, the commencement of Hong Kong's first Master of Public Health programs. And in 2001, Hong Kong, which becomes like the Hong Kong's the first and only school public health building, was established on site of Prince Wales Hospital. And in 2009, the School of Public Health and Primary Care was funded by the merger of the School of Public Health and the Department of Community and Family Medicine. Hong Kong's first Bachelor of Science program in public health was launched. And in 2014, the Center of Public Health and Primary Care, Shenzhen, was set up at the CHK Shenzhen Research Institute. And I am the director for this term. And then in 2024, our School of Public Health became the first and only institution in the region to have both a Bachelor of Science of Public Health and a Master of Public Health programs fully accredited by the APHEA, a leading global accreditation body for public health schools and programs. The member of our school public health, actually, we have more than 40 full-time teaching and research staffs. And we have 2,700 more students per annum. We have 10 research centers, including the Center for Clinical Research and Biostatistics, Center for Global Health, Health Behavior Research, which Professor Finismore here. Is the center director. And the health education, health promotion, health service and policy research is Professor E.K. Yao. And Center for Occupational Environmental Health Research, I'm the director now. And CCOUC, Collaborating Center for Oxford University, and CHK for Disaster and Medical Humanitarian Responses is Emily Chen, professor. And CHK Thomas Jane Center for Mindfulness Research and Training is Professor Samuel Wang. The Jockey Club's Center for Osteoporosis Care and Control, and SHO Research Center for Infectious Disease. We have 6 teaching disciplinaries, including family medicine and primary care. And public health, we include environment and occupational health, infectious disease, epidemiology and biostatistics, health system policy and management, health promotion and social behavior, and population and global health. We have 5 research themes, including non-communicable disease and aging, global health policy, health system, and healthcare delivery, bioinformatics, medical learning and big data, environment health, infectious disease, mental well-being, social and health behavior addictions. The program including undergrad, which include the Bachelor of Medicine, BSc in Public Health, Community Health Practice, and Gerontology, and minor programs in Public Health and medicine courses. For others, which include online course on disaster and medical humanitarian responses, public health training support services. And for postgraduate, we have a research base which include MPhil and MPH in public health, and taught programs which include Master of Public Health, Master of Science in Epibiostat, Health Service Management, and a postgraduate diploma in public health and Epibiostats. For the professional programs, we have professional diploma programs in occupational environmental medicine and occupational environmental hygiene, which I'm the director, and the program certificate program in health service leadership, Hong Ji Team, Professor Hong Ji Team and Professor Yao, Professor E.K. Yao, and professional certificate programs in biostatistics, in epidemiology, and in mindfulness-based cognitive therapy teacher training. And our academic strengths, we have about half, academic staff awarded as the world's top 2 scientists in 2025, including our Professor Samuel Wang, Professor E.K. Yao, and Professor Emily Chen, and other many of our research staffs. We have a research paper published annually, about 230 more, and we have 65 projects led by school core members as PI, awarded over 66 more million Hong Kong dollars, and we publish in world-leading, research journals, including leading, actually, Nature, Lancet, a series. And we have, with support of community, the Jockey Club School Public Health for Primary Care has been able to integrate research and practice, apply research to the community, provide service to the needy, and raise the public's awareness of healthcare, and keep abreast of the development of public health and primary care. The JCSPHPC has academic partnership in more than 20 countries and regions around the world. The network provides the rich and quality international exchange opportunities for students and faculty, and connects the school with regional and international public health and primary care challenges. The school is committed to providing a platform for local, national, regional, and global public health and primary care scholars to exchange research progress and achievement. So in the future, in the near future, from December 7 to 9, 2026, the school will host the April Global Health Conference 2026 on the prestige campus of the Chinese University of Hong Kong. The conference is themed as the resilience and adaptation navigating the evolving landscape of global health in a changing world. Thank you very much. You are very much welcome to participate in our future conference. Thank you so much.
Thank you, Professor Tse. Please be seated. Our next presentation will focus on regional collaboration. May I invite Professor Xiang Yutao, Distinguished Professor and Head of Department of Public Health and Medicinal Administration, Faculty of Health Sciences, University of Macau. He will speak on public mental health, an example of interdisciplinary collaboration in mainland China, Hong Kong, and Macau. Professor Xiang, please.
Thank you. Okay, good morning, everyone. First of all, I'd like to thank the invitation from Professor Bishai. My name is Yutao Xiang. Actually, you know, I'm very happy to come back to Hong Kong because actually I stayed 10 years here. I am a psychiatrist. Originally, I came from Beijing, China, and after received the medical training in Capital Medical University. After that, I pursued my PhD degree in Department of Psychiatry, Chinese University of Hong Kong. After that, I moved to Baltimore, the USA, and received the postdoc training, and then moved back to Hong Kong and then Macau. Today, I will share something about the public mental health. Actually, it is an example of interdisciplinary collaboration between mainland China, Hong Kong, and Macau. Guangdong province is very big. Hong Kong is also big, but Macau is only a small dot, in map. Actually, when I study in Hong Kong, I have to travel between the two sides by the ferry. But now we have the longest cross strait bridge, the Guangzhou Bridge, and yes. Hong Kong U has a very long history. CHK also have a long history. Sun Yat-sen University, a long history. I would say University of Macau have a very short history. And for example, right now, I'm working in Department of Public Health and Medicinal Administration, Faculty of Health Sciences. Our faculty was only set up 11 years ago, and our department was only set up 3 years ago. Actually, right now, we have 4 programs. We have undergraduate program of bioinformatics. We have the master program of global public health. By now, we have had 2 doctoral programs, including PhD program in biomedical sciences, as well as doctor program of global public doctor of public health program, DRPH. We just set up this program a couple of years ago. I'm the head of our department, and the associate head is Professor Xiang Yutao, who is an expert in medicinal administration. Actually, in our department, there are 2 sessions. One is public health, the other one is medicinal administration. Compared to Hong Kong U and Sun Yat-sen University and CHK, actually, our department is very small. Right now, we only have 16 professors in different levels, including distinguished professor, full professor, associate professor, as well as assistant professor. We also have 1 Macau fellow. You can see here are the numbers of students in our department. We have around 90 undergraduate students and 60 master students and 150 doctoral students. Well, today my introduction will mainly focus on public mental health. What is public mental health? Actually, it involves both public health and mental health and psychiatry. I'm a psychiatrist in mainland China, and right now in University of Macau, we do not have a medical school. We do not have a department of psychiatry. So my research mainly focuses on public mental health. Actually, it is a very important branch of public health, and mainly focus on population level and address mental health promotion, prevention, early identification, as well as treatment and recovery. And commonly used methods in this area include very traditional epidemiology and health economics, digital public health, and relevant methodology. It is very important. Why it is very important? Actually, in different subpopulations, right now, mental health problems are very common, such as depression, anxiety, sleep problems, and so on and so forth. I believe many of us actually suffer from these problems less or more, sooner or later. And in addition, for patients with major medical conditions such as diabetes, hypertension, and psychiatric comorbidities are also very common, such as suicide. When I studied in Hong Kong, I still remember the suicide rate in Hong Kong is very, very common. And we conducted a suicide prevention program with my supervisor, Professor Lin Hualiang, many years ago. And actually, up to now, there have been a lot of research outputs based on the collaboration between mainland China, Hong Kong, and Macau in the field of public mental health. Due to very limited time, I only use my lab, use my cooperation with colleagues in these areas as the example. Here, I did a very quick literature search in Web of Science using my name because I major in public mental health. There have been more than 700 outputs. Here are the annual publications based on cooperation on public mental health. You can see actually the trend keep increasing. Actually, it reaches a peak during the COVID-19 pandemic. Here are the most active international journals in this area. You can see actually in the past 10 years, Journal of Affective Disorder is the most active academic journal, published almost around 100 publications, followed by Frontiers in Psychiatry and Psychiatry Research. Here are the most researchers in the field of public mental health. You can see my name, and also Professor Terence Chang, who worked in Hong Kong Polytechnic University School of Nursing, and Professor Su Zhaohui from Southeast University. It is a very famous university in China, and Professor Lin Hualiang, who was my supervisor in CUHK, and also Professor Wang Gang, who is the Dean of Beijing Anning Hospital of Capital Medical University. Here are the active institutions in the field of public mental health, including our university and Capital Medical University, CUHK, and Hong Kong Polytechnic University, as well as Peking University. Here are the most cited publications, in the field of public mental health. The first one is my article published in Lancet Psychiatry. You can see actually the total citations have greater than 2,000, followed by another Lancet Psychiatry article, and also some other publications. Here are the international collaboration in the field of public mental health. You can see a lot of countries actually have been involved. For example, the cooperation between China and Australia is the most active ones, followed by the collaboration between China and the US, and also the cooperation between Australia and the US. It is a very, very active research area, public mental health. Here are the most active research areas in the field of public mental health. You can see there are so many very popular research areas. Due to limited time, I cannot introduce all these areas. Here are the cooperation, between different institutions. Well, finally, I'd like to share some specific examples. One of my major research focuses is psychiatric comorbidities of COVID-19 pandemic. By now, we have published more than 150 publications. This is the first article about the public mental health during the COVID-19 pandemic. It was published in Lancet Psychiatry, and there have been more than 5,000 citations. Actually, 20 years ago, when I worked in Beijing, I involved in fighting the SARS outbreak, and we have a lot of experiences and lessons. And actually, in the beginning of the COVID-19 pandemic, I shared our experience in this Lancet Psychiatry article, it is highly cited, contributed a lot in fighting COVID-19 pandemic. And another research area I'm doing actually is evidence-based medicine. You know, Macau is a very small city with very, very limited resources. We hope to contribute greatly to clinical practice. What is our choice? Actually, evidence-based medicine is the best choice. By now, we have published 180 meta-analyses and systematic reviews in the field of public mental health. This is an example. In this meta-analysis, we examine the prevalence of mild cognitive impairment among older adults. It is a global meta-analysis of epidemiology, and it has been highly cited, almost 500 citations, published in Age and Aging. Okay, the last sharing actually is depression. It is also one of my majors, and we have published more than 350 publications. This is an article published in American Journal of Psychiatry, and it is essentially it is a RCT, and we compare the efficacy and the safety issues between traditional treatment methods and environment-based care. Actually, the results are very encouraging. What we are planning to do in the future? Actually, there are these areas, actually, our dreams, we hope to do something, and we hope to conduct some cooperations in Greater Bay Area. The first one is digital interventions. The second one is clinical intervention to root care in the field of public mental health and psychiatry, such as use of RTMS and TDCS, and something like this. The last point actually is urbanization, migration, and work. And you know, these are major public health challenges in this area. So I really hope to have some cooperation with our colleagues in this area. Okay, this is the end of my presentation. And as addressed of Professor Xie and Professor Lin, actually, I really hope, more cooperation could be considered, could be conducted in Greater Bay Area. And all cooperation actually is welcome. Thank you.
Thank you, Professor Xiang. Please remain on stage as we will proceed directly into the Q&A. We will now open the floor for questions. Please submit your questions using the QR code. To moderate this discussion, we are honored to have Professor Leo Poon, Daniel CKU Professor in Virology, Chair Professor of Public Health Virology, and Head of Division of Public Health Laboratory Sciences of the School of Public Health HKU, Associate Dean in Human Capital, LKS Faculty of Medicine HKU, Co-Director, HKU Pasteur Research Pole, Co-Director, the Hong Kong Jockey Club Global Health Institute, to moderate the Q&A session. May I now invite Professor Poon to the stage. May I also invite Professor Maria Zhu and our panelists, Professor Lin and Professor Tse, to join us on stage, please.
Thank you so much. Today, we have been learning a lot from different universities, and then in different discipline, aspect of our scope in terms of public health. It's amazing that we actually form an alliance on addressing health issue. So I think my first questions to you is, what are our edge and our needs? How we can able to synergize the expertise that we have to have a collective effort to address health issue. So what are the gaps, and then what are the bottlenecks that prevent to this, or how we can able to synergize that? Do you have any insights on this aspect?
I mean, the gaps?
Yeah, the gaps, and how we can able to enhance the collaborations.
Okay. I think thanks for the question. So I'm just thinking about the gaps for public health. I think the gaps probably still have something in both education and the research. So in terms of education, because the world changing is so fast, and with so many uncertainties, but our public health, we need to actually to follow the pace of the development, particularly for the new emergence of, infectious disease, new virus, and also some, say, the rapid development of industry. So examples from like, say, new energy vehicle, because we have so many, say, the cars actually, you know, which is using the new energy with the combustion of the, say, the battery, and which will, particularly when the battery, the life ends, and then we need the recycling. So many problems will emerge, like, say, the new materials, like PFAS, and the chemicals. So that will be like the say the environmental say disrupting kind of chemicals. So I think our student, the education not only based on the fundamental public health, but also maybe some new knowledge in terms of this kind of development. Sorry, thank you.
Okay, thank you very much for the question. Actually, earlier, I mean, the three speakers introduced, respective institutions, and actually, I found that nobody introduced the achievements, I mean, based on the collaboration between the three areas. Here, I'd like to briefly introduce what we have done in the past, briefly speaking. Actually, apart from attending some, academic forum, symposium, and conferences, we have a lot of achievements. For example, I would like to share something using our university. For example, a couple of years ago, when we planning to set up our master program of global public health and the doctor program of public health, and our experts in Hong Kong, such as Professor Shelly Tse, and experts from mainland China, such as Zhang Siyan, the Dean of Public Health in Peking University, and experts from Xiang University, greatly help us and give us very, very valuable comments. I really appreciate Shelly and Professor Lin. And in our beginning, we are lack of teachers. So actually, for a lot of courses and professors from Xiang University, and actually have done a lot of things. Really appreciate. Obviously, there are some gaps and challenges we are facing. Guangdong, Macau, and Hong Kong actually have quite different social, cultural, and economic backgrounds. And apart from scientific forum and academic conferences, we are really hope to do a lot of things in other aspects, in other areas such as teaching. And for teaching, actually, in China, Putonghua, Mandarin is the official language, but in both Macau and Hong Kong, English is the only teaching language, and so the language barrier actually is a potential challenge. And research and grant application, and in Hong Kong and Macau, actually local grants are not open for researchers from mainland China, right? So for in the future, I really hope, we could apply for, joint grant. We could only do it in mainland China, but in Macau and Hong Kong, quite different, quite difficult. So I hope, we could, try to overcome these problems. Yes, and in the future, actually, I really hope we could, set up some joint programs, and students, for example, from Macau could enroll courses in China and Hong Kong. But seems that it is it is a dream. Far away. Yes, and also I noticed that actually the three areas narrower. Released. Expert consensus or guidelines. Actually, we could also do something in these areas. Okay, so that's it. Thank you.
Actually, I think this is a very good question, and exactly is that the purpose and the reason that we established this kind of Guangdong-Hong Kong-Macao Public Health Alliance. We want to address the gaps, both in the evidence and in the public health issues in the coming and in the future. So I would like to add a few other challenges that we are facing. The first one is in the, the international relationship actually has been quite different from a few years ago. So which impacts the collaboration between the countries. I think this is a very important issue in the now and in the coming years. So this is the first one. Another thing is in the aging population. In the aging population, that the chronically disease burden will be increasing. But now, actually, much more resources has been put on the infectious diseases from the government. Though we know that the infectious disease is also an important issue, especially for the emerging and re-emerging and for the new virus. This important, very important, but the resource allocation for the infectious disease and for the chronic disease should be kind of more balanced. So this is another one, and also the climate change, and also some other environmental threats. So I think the gaps for the solutions, I think using the digital data and tools and also the artificial intelligence, maybe we can have some more methods to handle this kind of issue challenges. Okay,
thank you so much. I'm actually even flooded with questions, so I'm sorry that I only can pick a few, but then I really want to pick the one from Bob, who is a GHD year 1 student, undergraduate student. So he has excellent questions. You know, all three of, got Macau, China, Hong Kong, we all in different governmental systems, have a different study, different regulation. How GBA, how can we actually work together as a GBA? In particular, for data exchange, sample exchange, what can we do to help to address it and able to work together and making the edge, using or leverage the advantage from each other's?
Okay, so I think this is a very important question. And I think now the three places actually becomes more and more integrate together. So so in terms of I think the key strategy could be including like enhancing data sharing, but I think there are barriers. There are barriers for data sharing because from the data security, the policy seems like the mainland data cannot cross border to Hong Kong. So this is challenging. I think a big challenging. So because currently I'm working with the National China CDC for using the national data, which is a huge, more than tens of millions data, but we cannot take data, which is, I think it's not possible. So we have to send our staff to Beijing or to mainland China, or even in Shenzhen, and to analyze the data. So I think this is, even if we have passion, but there are many, I don't know if we can work together to fight, and then we will get some permission for that. Yeah. And the second, I think we should expanding the joint talent training for young people. So the young student, including undergrad and say a master level student or even like a PhD student, focusing on, like Professor Lin said, is for bigger data, kind of data-driven and for the data hypothesis kind of analysis. And also to fostering the joint research on regional, but which is the critical public health issues focus. And then I think the collaboration can be quite kind of deepened if based on the program, particularly based on the joint, say the program, like in Hong Kong we have CIF, but it's hard, not easy. I felt this round, in the last round after interview, got wrong, but still need to even work hard, fight for next year. Yeah, my project actually is a global, it's a GBA, Greater Bay Area project, working on environment health, but interesting, but not, still, work hard. Thank you.
Okay, actually, my point have been addressed by Professor Xie, and I totally agree with Professor Xie's point. Actually, when I studied in Hong Kong, I could use HA data. I mean, after obtaining the IRB permission, but after my move to Macau, I could never use it once again. Actually, data sharing is really a big challenge. You know, actually, Macau, Hong Kong, and Guangdong are also part of China. And in principle, we should have user data, but actually, all things are separated. And however, I would say the trend is very encouraging, particularly in the COVID-19 pandemic. Actually, under the management of the Ministry of Health and also the central government, actually from time to time, the COVID-19 relevant data, have been well shared, right? Only during the COVID-19 pandemic. For research, essentially it is still, separated. However, the global trend, is open, right? For example, right now, some national databases have been open, such as the UK Biobank, the Charles, IOSA, UKB, and so on and so forth. And in mainland China, the CKB, I'm not sure if it is open. It should be open. And Professor Li Ming told me that, it will open in the future. And in general, the trend is keep open, and I'm optimistic about this thing. And about student exchange, or other type of exchanges, it is very important to, because it is facilitated to cooperation between this area. And once again, I really hope, our students could enroll the programs provided by other universities, such as Hong Kong U, CHK, and Xiang University. It is very beneficial for our students. Yes, thank you.
Okay, I think it's a very good question, and this question I think it's two parts. One is establish this kind of multi-center information to get them together to establish this kind of information or system or platform. And I think this is the one issue. But in some cities in China, this kind of information platform has been quite good. For example, in Hangzhou, in Yanzhou, in Zhejiang province, and in Yichang, in Hubei province has been good. This kind of information construction, I think this is one thing. And now the Chinese government has been put quite a lot of effort to establish this kind of data collection center. And we now have, in each province, in each city, we now have a department to collect the data from different sectors, not only in the health, medicine, and also others. But it's very difficult. But we hope that we can establish this kind of system to multiple center information. Okay, this is one issue. Another one is share. When we have the data, how the strategy, the mechanism that we can share within China, between cities and within other countries. So we need a lot more work to do. It's difficult. Data security and also many others. We know that, but we don't know how to solve this problem. Maybe, actually, we have many discussions recently, and I don't know, but they mentioned that the blockchain system or technology can be one tool that can protect the data security, something like that. I don't know, but maybe. Okay, thank you.
Thank you so much. I apologize to all the speakers and the audience. Time is up, and then now I have to stop. But I do have one final question, because this is one important question from the audience. If they want to join the alliance, would they allow to do so? Right? How? So I'm sure. Maybe someone can answer this, and how we can able to join.
Welcome. Welcome, because currently, the leading organizer is Yat-sen University. Yeah, Professor Xiang is the director of School Public Health. So if you are interested, please contact us. Yes. Yeah. Welcome.
After this, please talk to them and try to say, "Hey, I want to join." Okay. So with this, I thank you for all the speakers for your excellent introductions and then your inspiration insight about how we can enhance health in GBA. Thank you so much.
Thank you very much.
Thank you to our panelists and Professor Poon for a stimulating discussion. This concludes our Q&A session. May I invite Professor Poon and Professor Zhu to present a token of appreciation to our speakers. Professor Poon and Professor Zhu, please. Professor Tse, please. Thank you. Professor Xiang, please. Thank you. Please be seated. This concludes the first part of our morning. We will now have an intermission until 11:45. Audience may take the opportunity to visit our student poster session in the foyer. Please feel free to exchange ideas with our RPG students. Restrooms are also available on the first floor. We will resume promptly at 11:45 with plenary session 2. Please ensure you're back in your seats by then. Thank you and enjoy your break. Welcome back, everyone. Please be seated. Before we commence to plenary session 2, we will take a moment to review the second half of the program. We will now proceed to our second plenary session. The topic is Public Health Research and Education at HKU School of Public Health, Challenges and Opportunities in the Next 5 to 10 Years. First, may I invite our panelists and moderator to take their seats on stage, please. Professor David Bishai, Head of Division of Health Economics, Policy and Management. Professor Dennis Ip, Clinical Associate Professor and Head of the Division of Community Medicine and Public Health Practice. Professor Wendy Lam, Head of Division of Behavioral Sciences. Professor Leo Poon, Head of Division of Public Health Laboratory Sciences. Professor Parko Siu, Head of Kinesiology. Professor Jane Zhao, Representative of the Division of Epidemiology and Biostatistics. Professor Michael Chan, Professor of the School of Public Health, will be the moderator of this session. Professor Bishai will begin with an overview of the structure of our School of Public Health, followed by insights from our division head and representatives. Throughout the session, you are welcome to submit questions using the QR code. We will then open for a panel discussion and live Q&A moderated by Professor Michael Chan. Now I will pass the stage to Professor Bishai. Professor Bishai, please.
Thank you, everybody. Thank you for me. So I have 5 minutes to cover the entire school and my division. So I will be fast and brief because I've got help to help you understand the school. And there's a reading list for everybody. You're in a school, so this is your reading if you want to know about our school and our division. We have 6 academic divisions. They'll self-introduce in the next 20 minutes. We have a staff composition of 40 professors, balanced pretty evenly across professors, associates, and assistants. We have 59 academic-related staff, 14 teaching staff, 275 research and admin, and 440 total staff. Our degrees, I see here, we've been hearing from Zoe, one of our bachelor students. I see several bachelors of science students. I'm so proud of this program. It's one of the only global health programs that has 2 words at the end. It's the global health and development. We're very serious about the and development. Our students understand social science, architecture, law, policy, diplomacy, and they understand it very deeply, and they apply all that to health. So it's very interdisciplinary, and we're very proud of our students, and they're 100% employed after graduation. Thank you for all of our students and our faculty for this degree. We, of course, have a master's in public health, both full-time and part-time. This year, it has record enrollment, record applications, and we're so proud of our MPH students. I was with them last night as we were going through our material on leadership and management, and they do become leaders all around the world, including here in Hong Kong and in China. And several of our graduates were presenting today. Dr. Ronald Lam is a graduate, and we'll be honoring our Delta Omegas later on, who are Masters in Public Health. We have several RPG students. If you've been at the break, you saw the posters of our RPG students. So thrilled, so proud of this world-class research, and that's how we sustain innovation and opportunities for the next challenges. We have a minor in kinesiology. You saw some of the posters in kinesiology. This is the very popular undergraduate minor with a lot of our students in undergrad learning principles of kinesiology and lifelong wellness. Our latest addition to our curriculum is the postgraduate certificate in healthcare leadership and management. This is led by Professor Sophia Chan and has a collaboration with Case Western University and the University of Oxford to grow the next generation of leaders in hospitals and nursing and in healthcare. And we're excited to have this join our portfolio. So that's the school, but not all of the school. Because I've used up half my time, I want to cheat and use some slides for my division. I know you don't have slides, but please indulge me just to get through my division with a couple of slides, because I only have 2 minutes left. Can I get my slides up here? No? All right, I'll just wing it then. I will wing it with no slides, just like the rest of you. In the Division of Health Economics, Policy, and Management, we have three professoriate. We've got Manuel Espinoza and Chao Kwan. Our focuses are on costs of diseases and costs of solutions to disease. So we study the cost of tobacco, the cost of alcohol, the cost of road safety, because when we tell you how much a problem costs, we can gather attention to it, and we can also tell you the cost of solutions. We study health disparities. We have now become a WHO inequality measuring center, so we work with other WHO member states in order to improve the training in the measurement of health disparities. Professor Manuel Espinoza is focusing on distributional cost effectiveness analysis to study not only what is cost effective, but how it impacts the poorest of the poor and creates a lowering of disparities. So it's not enough to be cost effective. You also want to make sure you are narrowing the gaps in society, and we're so glad that Manuel's research and outcomes are doing that. We all study non-communicable diseases. We do pharmacoeconomics of treatments for cancer, treatments for diabetes. Professor Chao Kwan has a very highly cited model so that if we know a population's diabetes, hemoglobin A1C, and systolic blood pressure, we can predict the cost of that population. Very useful for the hospital authority. We're doing frontier research and microsimulation and Markov modeling, not just applying it, but working on new methodology in these two fundamental tools. Going forward, we'll be working much more with the Hong Kong government on health technology assessment. We have a commission project with the hospital authority to help all of us in Hong Kong benefit from these innovations in health economics, policy, and management. I hope I haven't gone too much over time, and I want to have you pay attention to my esteemed colleagues to discover the other divisions of our school.
All right, okay, thank you very much, David. Because of the time, let's give you a very brief summary and also highlight some important development in the Division of Public Health Practice and Community Medicine. As the name implies, it actually gives a lot about us. We emphasize on practice, both doing research to inform advanced practice and also translating our research to inform better practice. And also we emphasize a lot on community engagement, which basically informs all our three important activities. Of course, we are very much into research, as I elaborated, but we also, colleagues in our division also puts a lot of efforts into education, knowledge exchange, and also, very importantly, capacity building efforts. And also, we actually do services, advanced services to benefit the society. Let me just highlight a few of those newer developments, things that had happened recently or are going to happen. In terms of research, we used to, as I said, take a very practical approach, trying to see whether we can gather evidence base to inform current policy directions. We used to do very well in areas like tobacco research, smoking cessation, led by Professor T.H. Lam, Professor Sophia Chen, and also Judith McKay here. And we'll continue in this direction. For instance, we have some newer studies like the data zone for profiling district health profiles, which would help to provide the very important database to inform the current government policy, health policy reform as the evidence base behind it. And also we are embarking on a new study, 10-year RCT, to look at the public health aspect of lung cancer screening using low-density CT in Hong Kong. So as to provide the information behind how we should bring this forward as a community health screening program in Hong Kong. And when I chat with our colleagues and also stock take to prepare for this panel, I also discovered that we have several emerging areas that we never sit down and talked about. Some of our new programs are trying to look at more advanced type of providing the preventive healthcare in the community, and also using advanced technology. For instance, Professor Chen's work together with Professor Michael Ni, they are going to kickstart 2 new RCT to look at the prevention and screening of women's health in Hong Kong, using a very innovative nurse-lead model with risk-based assessment, and also another RCT to look at whether we can provide more personalized advices to inform obesity and overweight advices prevention in Hong Kong. And also, we are having another new study collaborating with the Department of Physics using a new approach, ultra-fast laser technology, to look at molecular fingerprinting to see whether we can push for more precise kind of screening for different NCDs in Hong Kong. So this is basically the research side. And as I said, we also dedicate a lot of time for capacity building, as illustrated by many of our programs. Of course, we contribute a lot to different undergraduate program, postgraduate program, but also we have some vocational training, professional training, as illustrated by what David has mentioned, the Nurse Fellowship, Nurse Leadership Fellowship Program, led by Professor Sophia Chen, and also the Public Health Academy, Primary Healthcare Academy, and also we are involved in organizing a program to have 48 young talents from China as sponsored by the NXC to have half years of training in Hong Kong. And many of these programs would help us to build up very long-term, important collaborative relationship that would prove to be very useful to our different works. Thank you.
Thank you so much. I'm representing the Public Health Laboratory Science divisions. So our faculty members in these divisions are mostly lab scientists. So we work on animals, biological specimen, handling those samples and in a laboratory. So our strength is focusing on emerging infectious diseases. So and using the One Health concept. We have been so lucky that, or fortunate that we managed to create a critical mass with outstanding scientists. Many of them actually top 1% scientists or highly cited scientists. So, I mean, in terms of research excellence, I think that we are very proud of this. And today, I'm not going to talk about how good or how bad they are, how good they are in terms of academic research. They are all good and able to actually make recognized impact in terms of academic research, publish a lot of outstanding papers. But I would like to focus on the other initiatives. I mean, our labs or our divisions is a WHO reference lab of avian influenza virus, H5, and then also SARS-CoV-2, COVID-19. So I think we do have a track record to engage international community. So during the COVID-19, we have been doing a lot of academic research. Some of them are actually very basic one, but we can manage to translate this into public health control measures. So we have been doing a lot of molecular epidemiology, a lot of transmission studies using animal model to show the transmission mode of these viruses. So we have been trying to use our knowledge to try to do some experiment to generate data to inform public health action. I think this is one of the very unique advantage or strength of our divisions, how we can able to use public health, how basic science to try to inform public health, and then how to serve the community well. And then we have been sharing our data to the Hong Kong government, WHO, and other organizations to basically inform them so that they can have a much prompt decisions or actions. Well, the other thing that I think I would like to say is now in the past few years, I think the current geographical relationship, international ones, have been changed substantially. We really want to use this division to try to make global impact. And we have several initiatives such as we have been a long-term partner to work with Institut Pasteur. We are the Hong Kong U Pasteur Research Pole. We have been trying to use this network to try to control other type of infectious disease. For example, just 12 months ago, we actually launched a symposium for avian influenza H5 symposium in Cambodia, and to try to bring all the Pasteur network members in Cambodia to try to discuss how we can control H5N1 in this geographical location. So we can manage to pull different experts from different Pasteur network members to come together and try to discuss and see how we can exchange data, how we can exchange expertise to try to control H5N1. And bear in mind that H5N1 has been circulating at the global level. We really want to use Asia as a leadership to show the leadership control H5N1. In Hong Kong, even we had detected the first H5N1 case in 1997. But in the past 20-odd years, we never have a single case. That reflects our public health actions can able to control or prevent the risk of having zoonotic diseases. Right? And then the other thing is, apart from Hong Kong U Pasteur research activities, we do have other activities like Global Health Institute, funded by Jockey Club. So this is another initiative to try to fight for pandemic preparedness. We have different partners like IVI from International Vaccine Institutes from South Korea. We have the University of Cambridge to work together to form this tripartite relationship to try to work on, try to develop new methods to control pandemic diseases, right? How we can come up with more effective vaccines, how we can come up with better control measures, and how we can able to use these to benefit the Hong Kong community and beyond. I think this is a very good initiative, and then we would like to try to build Hong Kong as a hub for pandemic preparedness. And then the third thing is about innovation. I mean, I'm so glad that Michael mentioned about the future. And we also have done something, and then we have a Center of Immunology and Infection in Science Park. So in the past few years, ITC from Hong Kong government managed to fund us to try to generate servant translation research program. And some of them have been quite successful. We have already generated a few spin-off for organoid vaccines and also vector-borne diseases. So we will try to use this as opportunity to create opportunity to attract or engage other partners beyond academia so that we can able to increase the critical mass. At the end of the day, we want to try to translate some of our findings into real applications so that our communities can get our product, right? Not because we want to make money, but we want our good technologies able to influence the community so that we can improve the health in Hong Kong and beyond. So I think there were a lot of opportunities for us, and this is an exciting moment, both in terms of research, international relationship, and also entrepreneurships. I think these are the things that I think our division is now heavily engaged in these directions. With this, I thank you for your attention.
Hi, so I'm representing the Division of Behavioral Sciences. Maybe I would like to take the opportunity to actually explain a little bit about, the discipline of behavioral sciences. It is a very broad discipline that we often actually apply for different theories. For example, we draw theories from psychology, sociology, communication, decision-making, to try to understand how to identify driver to how to actually change people's behavior. So this is basically what we do. But when you look at the size of our division is actually very small. We only have like 2.5 academic staff. And so you can imagine how difficult it is in terms of, trying to cover everything. So in order to be strategic, so we actually focus on very narrow areas in order to try to become the excellence in that particular area. So I have one of our colleagues, Professor Julie Lau. So her work focused primarily on looking at how to apply theory of psychology and also communication to look at enhance people's behavior in terms of tackling vaccine hesitance, and also how to actually enhance behavioral changes in terms of vaccine uptake, etc. So she actually does a lot of work in this area, and during SARS and during COVID pandemic, she actually collaborated with other divisions to work in this area. So we also have another colleague in our division who focus on looking at aging, in particular looking at how to use policy in order to enhance end-of-life care. So we have colleagues who focus in this area. And then another strength or the focus that we work on is in psycho-oncology. So in particularly, we focus on how to integrate psychosocial care into routine cancer care, because we know this is also one of the area that is important to enhance cancer survivors' living and also survivors as well. So we recently got the JC project. So we actually had the Jockey Club Institute of Cancer Care. So we are the one in Hong Kong who actually established the cancer survivorship program. And recently, we actually got the funding from Jockey Club. So in the coming 3 years, we're going to establish a cohort of over 12,000 cancer survivors. And we are hoping using this cohort, we'll be able to help us to understand some of the survival outcome in terms of this particular cohort, and looking at the impact of cancer treatments and how it actually affect patients' survival as well as behavioral changes as well. So these are the areas that we are focusing on. And internationally, in terms of psycho-oncology, we are actually the leading institute as well. And over the years, we actually leading the international collaborators to develop core competency, how to integrate psychosocial care into routine cancer care. And also, we are currently developing monitoring indicator in terms of how to get the countries to integrate psychosocial care into routine cancer care. So these are some of the areas that we are working on. And in the coming futures, we are actually moving into a direction to look at the role of implementation sciences, because this is also a very important area and also very much related to behavioral science as well. So we're currently using implementation science to try to train physicians, trying to train our NGO partners how to actually implement evidence-based behavioral intervention in order to enhance population health. Thank you.
All right, good morning. I'm Parker Su, representing the Division of Kinesiology. So our division actually had the expertise in exercise and health. I think everybody know about exercise is good for health, but what we are focusing now is on the science. behind exercise and health, which is actually another level of the knowledge. So my division actually offer education on exercise and health to the student from our faculty, medical student, nursing student. We also offer a minor program in kinesiology to all the undergraduate students at HKU, which is actually one of the very popular minor program, as David mentioned it before. For research, actually we perform research surrounding the topic on exercise and health or physical activity benefit. I myself actually work on the topic to see how we can actually provide evidence to allow the people to identify the most effective exercise modality or physical activity, the way to enhance their health. And I do have also colleague Professor Yang Kim actually work on the more epidemiological area on physical activity. He even looked at whether exercise or physical activity can help you, even you are carrying some kind of the genetic risk for certain chronic diseases. We have another member, Professor Jacob Pistisco, and actually he worked on the so-called time use epidemiology, including physical activity. If you want to exercise more, you have to take time from the other component of your daily life. And that become a very interesting topic to look at how you're going to use your 24 hours time per day. But in general, our division actually work on to generate the strong evidence and reliable information to advise how the general public or even diseased population, they should acquire their recommended physical activity recommended by the World Health Organization. I think you know about the movement of Hong Kong, actually. Hong Kong government is very eager to develop Hong Kong as a sports city. As you can see, a lot of sporting events just passed the national game, and in the coming time, it's going to be an Olympic game. All the Hong Kong elite athletes, they are striving to get a good performance. But even that, I think that will be very useful for making use of exercise, sports, physical activity to enhance our overall health. That will have a very big impact regarding the public health perspective to actually contribute to lower our health burden. I think that's pretty much about the brief summary of our division. Thank you.
Hi, I'm Jen. It's my honor to present our division on epidemiology and biostatistics, presenting our division head, Professor Ben Collin. Our division covers quite wide range of research directions, including infectious disease epidemiology, led by Professor Ben Collin and Professor Joseph Wu, and also non-communicable chronic disease epidemiology, like me, myself, and also Dr. Ronald Lam, and also environmental health, like Professor Lin Hualiang's team. So we cover quite wide range of research directions. In the morning session, I keep hearing the words of changing and also collaboration. And I think the most important change we have encountered in the past years is COVID. And our division made significant contributions to COVID pandemic preparedness through infectious disease modeling, which made important reference for the government to make policy recommendations, which shows our division's capability to always get prepared for emerging infectious disease. And also, we have been working hard on non-communicable chronic disease. We are trying to use robust causal inference methods to find modifiable targets for prevention and treatment for chronic disease. And also, in the past years, no matter in chronic disease or infectious disease, we have built very good research capability. We have built large cohorts, large biobanks, and also large surveillance data. as well as large clinical trials. So in the future, we want to make full use of these valuable data sets, and we want to use this as a basis and to enlarge our, strengthen our collaborations in the Greater Bay Area and also internationally. Actually, our school has been always emphasizing the importance of collaboration, and also we also realize the opportunity and the challenge in front of us. For example, we always know that disease is complex. It's not only one single aspect. For example, healthy aging in my area, we know that it's not only the diagnosis, the treatment, but also the society level, also the cost effectiveness, also the policy. So we need different disciplines to work together. So that's why our school has initiated 2 collaboration hubs. One is led by me is Healthy Aging Collaboration Hub, and the other is One Health Collaboration Hub, led by Professor Hualiang in Leo's division. So we are trying to use this kind of collaborations to work together in these big challenges. And also the other challenges, there are many things we want to do, but we have limited resources. For example, we want to maintain our big data set, but we need continuous funding support to support this manpower issue and also the data maintenance, etc. So the solution is we need collaboration. So in the future, we do hope to strengthen our collaborations within department, within faculty, across faculties, like in the morning's keynote, Professor Lu mentioned the Berkeley Health model. And also, we want to strengthen our collaboration internationally. Like currently, we already built collaborations across like US, UK, with like Harvard, Columbia, Bristol University, Cambridge, etc. But in the future, we want to enlarge our networks, and we believe that when we go together, we can walk longer. Thank you very much.
Okay, so thank you for college for a general introduction and also the challenges that may actually face. So according to questions, interestingly, quite a number of them want to look into interdisciplinary collaboration or how to enhance the interdivision collaboration within the School of Public Health. I think this is actually a good opportunity. Apart from single individual from Great Bay Area, even from Berkeley, we now have all division members here. How about you can share with us how can you guys enhance interdivision collaboration in order to achieve interdisciplinary research, and maybe not only focusing on research, we also think about education and also knowledge exchange. How will you see this opportunity within our divisions? Please.
Right. I think this is a challenging question, right? Because as a bunch of lab-based scientists, we talk about laboratory data, right? But I'm joking. But then actually there are a lot of opportunities. I think during the COVID-19, I think the epi team and the lab side actually work together on understanding the epidemiology of COVID-19. So I think there are a lot of opportunity. And then also we are thinking about health, and then there's a lot of laboratory tests to inform health, right? How exercise can improve health, what are the health parameters? I just give you one example. In C2I, our translation research hub, we do actually have a cohort of 1,000 individuals. These are whole healthy individuals, which is age stratified cohort. Right, and then we have been analyzing them using different parameters, using different omics, and they try to find the biomarker to inform health. And I think that brings a lot of opportunity, like how exercise can able to modulate the health parameters, right? And then how exercise can modulate the mental wellness. So there are a lot of opportunity, but the real problem here as an academic institute, I'm advocate for research funding. Right, how we can able to, we need to get the incentive to try to get people to work together. We are all good. I would say all the people sitting here and in our school, they're all academic outstanding. But we don't have enough resources, We only have limited resources to try to deliver a certain portfolio. I get a grant, I need to deliver my KPIs A, B, C, D, E. And then how we can able to leverage this by just telling another person who can donate or try to fund us to do interdisciplinary research. I think that would be something that I think we are lacking at the moment.
Thanks, Leo. Yes, the incentive structures of universities are a challenge, but they're also an opportunity. We know that our leadership of Hong Kong U is the people of Hong Kong U want us to work together, and we have worked together. If you look at those highly cited research papers, multiple divisions always contribute to it. This faculty is just collaboration is their middle name. Looking at the opportunities and innovations and challenges in Hong Kong, primary health care is really our future. It is calling us. And one of the innovations in primary health care is the social prescribing. We've been talking about this very actively, and our school is putting together an interdisciplinary project to help support our district health centers as we start to embrace link workers and social prescribing. Critical to that is showing how a link worker could help with mental health, how a link worker could help with exercise and diet. Link workers are good at that. The economists obviously want to show that it's cost effective, that if you do these interventions through social prescribing, you will offset costs to the hospital authority. These papers have been written in the UK, but Hong Kong policy environment requires us to do that in Hong Kong. And so the economists in the school want to be supportive of that new opportunity. The opportunity also in mental health, for sure. And we are very interested in the work that Michael Nee is doing, where he is producing profiles of several of Hong Kong's districts' mental health upstream determinants, not the proximal, but the distal determinants of mental health among youth age 16 to 23. That is cross-disciplinary. We would need the work of our behavioral health division. We obviously need the work of epidemiology and statistics. And coming soon would be this, what do you do about it? And here we need our comprehensive primary health care and practice partners to feed back to the district community, to the people, to be inclusive. Like Michael Liu was saying, the change-making toolkit is our future. The change-making toolkit's part of what we teach and what we research. How do you open a policy window? And you open it by bringing in the people of a district into the conversation about the thing they care deeply about. If we were to say, raise your hand, do you want disease or do you want health? The people in the districts of Hong Kong want health, and they want mental health. So it's so important that that is an interdisciplinary area where there's challenge, opportunity, and innovation. And we're the team for the job. I know we're small, but we leverage, we work with partners, and that's how you get it done.
Maybe I can also supplement a little bit regarding collaboration issues, not so much regarding interdisciplinary, but collaboration on a wider scale. Those projects that I mentioned earlier in our division, not only research, but also capacity building and service program actually helps a lot for us to bring up very long-term relationship with a lot of partners. Many of those studies that we are doing involved large number of community partners. For instance, we are now working with 8 large NGOs and many of the service outlets for these studies. And also we have hundreds of schools in our networks to inform our programs in school surveillance and also other things like evaluation of vaccine effectiveness. When we do vaccine, what may be the impact on the society when we do it in the school rather than on an individual clinic basis. Those also needs a very long-term years of relationship to build up so that people trust you, know who you are, how you do things, to build up this mutual collaborative relationship. And that is why we do a lot of things like we actually have a team going to do services to bring them good quality services as one of the service delivery team using the government vaccine subsidy schemes with no commitment. They don't have to commit to us on any research. We just want to deliver quality service, so they trust our name. We are basically one of the biggest service provider in terms of these school-based vaccination services over the years. And by this, we built up a lot of schools having confidence on us, and then they are very happy to participate in our research. Also, NGOs is also very important. Therefore, as I mentioned, many of those capacity building work would be very important for us to build a long-term relationship with healthcare professionals of other disciplines, and also those undergoing training, those who become leaders in the future. This very long-term relationship and trust will be very useful. So perhaps we can't just be focused on very short-term research output when we talk about collaboration.
Yeah, I just want to echo what Dennis just said, using the examples that we work on cancer survivorship, for instance, because we actually have built a very long-term relationship, not only with the hospital, but also with the NGOs as well. So we are able to actually pull together all the HA hospital who actually provide cancer service, in addition to the NGO who provide the cancer support service in the community all together. And we bridge them in order to be able to, because Sophia actually published a cancer strategies report in 2019. And one of the highlights she mentioned is, how to bring cancer survivorship into community. And now we are doing it because there have been a lot of challenges doing it, but because of the long-term collaboration with the HA and also with the NGO partners. So we are now leading this and trying to basically demonstrate that we can actually bring in using a community-based cancer survivorship. And also, like David said earlier on, we are also using peer-led. How do we actually write on the social prescription in order to get the peers to actually prescribe the different various intervention in order to help cancer survivors to actually live better, live healthier. So we are actually working on that. So I think, when we talk about collaboration, we also have to go beyond and thinking about how can we actually collaborate with the bigger communities as well. Thank you.
I think I can share a little bit. My division actually is the youngest. We established actually 8 years ago. And since we established and joined the School of Public Health, that's actually the question I always think about, how to better collaborate with the other division. And if I can recall the Professor Michael Lu's presentation about when we look at the big challenge about health, we must look at the problem or the health issue from the top, and you have to consider so many parameters. From my perspective, if I only look at exercise, it's going to be very difficult if you link it to the health equality. If you are rich, you can easily buy your gym membership. You get your personal trainer to get you to be healthy because you are physically active. But if you are not on the bottom of the society, you still worry about your daily life earning. How can you talk about exercise, which is very luxury to them? If I put that example to our research, actually we need to really consider so many factors. So I think that when we look at the health big problem, we definitely need to do in interdisciplinary collaboration. That's why I always think about we need to have the epidemiology, the division to support us by looking at the big data, to drive us about the direction. We always think about the behavioral science because they always form the rationale for us to, prescribe or advise exercise. Even health economic, I think we can talk about the cost. If we exercise more, how much you're going to save for the government. I think that really very important for us. We know well about our own discipline and specialty. We speak our language very well. But I think we also need to speak the other language in order to have another perspective to tackle the issue or the problem by considering all the angle and the parameter. But I think the challenge or the problem is because of our division is not too many, too big, and actually we need to focus a little bit on our research agenda as well as education. I think but definitely we can do a lot more. Thanks.
Thank you. I want to talk more on the collaboration in the knowledge exchange and education part. Last year, when I recall my experience in Harvard as a Takami Fellow, what surprised me is my fellow colleagues are actually from many different backgrounds, like they are from law, they are from some dental health, which are something I didn't expect can be linked to public health. So, so that echoes this morning's keynote Professor Lu mentioned. Actually, public health is a place where we attract many different areas. So that actually makes our public health area a very good place to do this kind of interdisciplinary education. For example, when we host the Healthy Aging Collaboration Hub, when we do this kind of epidemiology method seminar workshop, we attracted many students and early junior colleagues from other departments in the faculty and beyond the faculty, which means that they are very interested in our area. So and also we can see that in our MPH students, we have different backgrounds. Some are from law, some are from economics. So these are very, very promising signs that we can do more on this collaborative collaboration in education. And also, if we look at epidemiology methods, like in my area, Mainland randomization, actually is something that we brainstorm we borrow actually from economics, and we introduce the idea to epidemiology. And this method has been widely used. And also in my research, the part I really enjoy is the brainstorming part with different with colleagues from different divisions or different areas. And so I think this kind of interest or passion or enthusiasm may be the step we can start with. And also I echo with the previous comments that we do have challenges. And also like Professor Lu mentioned, we need the ecosystem, which are all very important. But maybe we can start with a very small step and then we enlarge the scale. Yeah.
Okay, thank you. So because of the limit of time, let me pick some of the questions. Many our students is giving some comments. And I think we do agree because of school, right? One of the main duty is education, right? We face different generation of students. We do agree that we need to educate differently, right? So one of these questions from our GHD students asked us, what would you expect our specific quality and the skills that you want us to develop after we have the course from you? So I think this is also reflecting, our vision to, younger generation, how will education, how will you guys be educated? So please.
Thank you, GHD students. That's why you're here, to ask the hard questions, I am lucky that Professor Michael Liu was asked that question of what should we do? He was part of our GHD curricular review yesterday. And thanks for making it easy, Michael, because his answer is the answer I'll give you. GHD and all students and all faculty, what you know now is going to be less relevant next year, 10 years from now. What we all need to do, students and faculty, is establish lifelong learning, keep our brains active, embrace the next thing. Obviously, AI is one of the next things, but also the framework that helps us be relevant is listening, tuning in. We just talked about tuning in to other disciplines, listening to your colleagues that aren't in your discipline, listening to the community. That is how you will stay relevant, and lifelong learning. And so for my students in GHD, that D is for development, not just of countries, but of people. Your development comes from what the communities did to develop. They listened to each other and they collaborated and they looked forward. What was the next thing they would need to know and do in their capabilities? So I had an easy, it sounded like a hard question, but thanks to Michael, I had an answer, and maybe I'll turn it over to my colleagues. What would you say we need to give them?
Right. So I just give you an example. I'm a basic biologist. When I was training as my PhD, I'm just supposed to do in the lab mixing solution between tubes and then try to read the reading, publish a paper. That's it. Right. So, but now we all sitting here, we actually talk about public health. So just make sure that you keep your door open, right? And then you learn, and focus on something to achieve your KPI, which is fine. But you have to keep on looking for other situations so that you can use your specialties to try to apply to that particular area. I think one thing that I really want is, I mean, I'm Shelly and I was in Beijing yesterday. We were surprised that WHO, there are not many Chinese actually working in WHO, right? That reflects that maybe we should try to train our students be more open, try to know more other cultures, to try to work with other people outside Hong Kong, outside China, so that they can able to connect other people. So the soft power, soft skill is the thing that I think you may not able to learn in the course directly. Then no one actually tell you how to do things like this. But I hope the course will give you the context, and then also try to equip yourself to try to equip those soft power, and to try to work with other people to public health also talk about relationship. How you can maintain a good relationship to other people, to our community is actually very important. I hope, apart from what we actually teach in the class, there are other things that you need to equip in a few years. And then in the practicum or in the other work situation, you were able to apply those to try to polish your skill, and so that you can make an impact to the community.
I agree with Leo very much. The relationship that he mentioned in Chinese is called guanxi. Guanxi is not taking advantage because you know someone but you are not competent. Guanxi is the long-term relationship that I just mentioned, how you build up trust. And I think one thing is very important, just now I missed that out, collaborating with the government, getting them to trust you, give you the data. Many of our projects also, heavily supported by the government, they give us very important, even a bit sensitive data. But I mean, how we do that, we talk to them, what you actually wanted, how can we help, rather than giving them some complication that suddenly surprise them. I think that is the key, to communicate, try to be helpful rather than try to grab something that I may publish great paper. That may be the very important thing that you have to learn to build up guanxi.
Just to add, one small comments. I think as an educator, it is our responsibility to making sure that students learn about the theories in classes and how to apply in real life situation. And I think it's our role to help students to be our role as an advocator to actually advocate students how to actually learn the skills to apply the conceptual framework that you learn in classes and how to actually apply in real life situation. And I think this is something that we would like to pass it on to our students. Thank you.
Well, if I can further echo and strengthen the application aspect, because I teach exercise, benefit, you know about it, but the most important thing is to do it. Once you do it, you apply what you learn from our lecture, then you feel what exactly we are talking about. I think if we apply the same example to GHD student, you also need to apply what you learn from your classes. But I can guarantee you're going to find whatever you learn will not be enough to solve the problem when you're going to encounter, because you never know what problem is going to pop up from your future boss, from the real world, because we are in a very rapidly changing environment. And you never know how complicated is going to be the problem. But anyway, as long as you have some knowledge, some background, make use of your clever brain and think wisely based on what you have learned, come up with your own solution and to impress your employer, your superior, whatever. I think that's really what we want to see from the teacher perspective. Is not to only see the student memorize, getting a high mark, but to see the student really apply the knowledge and to bring the problem into a workable and solvable level. Thank you.
Yeah, I agree with Leo and Dennis that the soft skills are actually really important because nowadays we can actually find answers, find knowledge, information from AI so easily. So it's actually, as a teacher, actually we can't just teach students knowledge, but also to change their mind of how to respond to this changing world. And also I feel like when I reflecting my teaching in the PBL class, open to MBBS, which is a problem-based learning, actually I didn't tell much. It's not a lecture. I just create the environment for them to open their mind and to discuss, to brainstorm. And in the end, it worked so well. And they actually discussed, touched many good points, which are beyond my tutorial guide. So this actually gave me the idea that actually we are not lack of knowledge. What we really need is the communication skills and also how to promote students to open their heart and to respect each other and to promote their discuss and to learn from each other. And that's really important skills which can be applied in their future career, how to communicate with like health authority or Department of Health, etc. Yeah, that's something I think quite important.
Thank you, colleagues, for sharing their vision on the students and also the challenges each division is faced. And thank you for your time. Thank you.
Thank you very much for our entire panel and Professor Michael Chan for the moderation. Please remain on stage for a group photo.
Ready, 1, 2. One more. Thank you.
Thank you, and please be seated. We will now present the Best Student Poster Award. To host this session, may I invite Professor Julie Liao and Professor Sheikh Taslim Ali, Assistant Professors of the School of Public Health, to the stage, please.
Hi, it's my pleasure to announce the awards of the Best Student Poster Award. Before I announce the results, I would like to take this opportunity to thank our panel members for their time and effort in evaluating students' poster, and also our colleagues in the general office to coordinate these sessions. Now, let me announce the results. So the first will be the second runner-up. The second runner-up is Canton Tonya.
Awardees, please come to the stage one by one for the award presentation.
And the first runner-up is Wang Jianhui. And the winner is Li Xinyi. Congratulations. Please join me in congratulating our students for their impressive research work. Now, Professor Ali will be presenting the certificate to our students. Congratulations.
Please all come on to the stage for our group photo. Congratulations to all awardees, and thank you, Professor Liao, and thank you, Professor Ali. To formally bring the forum to a close, may I now invite Professor Michael Chan, Chair of Organizing Committee, Public Health Forum 2026, to deliver the closing remarks. Professor Chan, please.
Thank you. Thank you. Okay. Good afternoon, distinguished guests, speakers, colleagues, and friends from government, other partner organizations, and also from the University of Hong Kong, and also from other universities. A very warm welcome to you all, and a heartfelt thanks for spending your time with us for this year Public Health Forum. So this year forum brings together more than 200 registrants from different organizations and universities, evident to share the commitment across different public health sectors. And impressively, our poster section featured more than about 50 very high-quality posters reflecting our students, their depth, and also the importance of the public health concept among our community. And I also want to extend my sincere thank you to all our speakers, panelists, moderators for volunteering their expertise and time. Special thanks to Professor Julia Lihao and also Professor Chak-sing Lau for chairing the poster sections. And also to our judging panel for their generous help and support, including Professor Xiang Yutao, Professor Chen Sanwang, Dr. Alex Lee, Dr. Caroline Cohen, Dr. Lik Ko-chen, Dr. Connie Wong, and your guidance and fruitful feedback to the students. I really their work and also across the plenary and keynote section, a very clear messages have been emerged. We imagine the public health by fostering the interdisciplinary collaboration, which can strengthen the relationship among region and also globally partnership. And we have to move into innovation through our research, education, and our practice. So we confine this is a challenge, not only in chronic disease, but also pollutions, climate change, emerging infectious disease. So we want to recognize extraordinary opportunity to rebuild these foundations and also advance health qualities. Together, I guess this forum give us an understanding of strategical visions why we have to transform public health to our next levels. Furthermore, I am especially encouraged that half of the participants today is our students. So we have a lot of students presenting their work. They are not only graduate students, they're not only working with lab science, but also a large disciplinary among public health. So the poster session gives us the idea of what they're working on, what will be the vision on public health. So our GHD, our MPH students also have a chance to support and participate in this large-scale event, which is a practical examples and also help the next generation of our students to experience how the public health can go to the next level. As we close, thank you for all your active participation. I hope you find this discussion productive, stimulating, and helpful. So my deep appreciation also goes to the organization committee, which helped to make this possible, and also all the workers from the school and staff member, volunteers, who are actually behind the scenes, can also make this today a very good event. So let's carry forward the connection we make here and the idea that we exchange, and also we share the idea of the new level of public health. So have a safe travel, and we look forward to see you all in the next year Public Health Forum. Thank you.
Thank you, Professor Chan. Please remain on stage. Before we conclude, let's recognize the hard work behind today's event. May I invite all members of the organizing committee to join Professor Chan on stage for a final group photo. Dr. Luis Gabriel Bernal Palaito, Professor Manuel Antonio Espinoza, Professor Jane Zhao, Professor Youngwon Kim, Dr. Ni Yan Yan, and Professor Maria Zhu. Please join us on stage. Thank you, everyone. Please be seated. This year, our forum includes a very special event, inaugural induction ceremony for Zeta Alpha Delta Omega chapter of the School of Public Health. May I now invite Dr. Polly Wong, Senior Lecturer of the School of Public Health, to give us an introduction. Dr. Wong, please.
Hello, everyone. I'm Dr. Polly Wong. I'm a senior lecturer here at the School of Public Health. In 2025, the School of Public Health established the Zeta Alpha chapter of the Delta Omega Society. And today is our inaugural ceremony for induction for our inductees in 2025. The Delta Omega is a national honorary society for public health. There are over 130 chapters around the world, and we're very proud to start our own chapter here at School of Public Health to celebrate the success of our members in our own school and our university. Membership into the Delta Omega includes students, alumni, faculty, and honorary members that exemplifies extraordinary dedication and outstanding achievements in the field of public health. To our inductees today, we're honored to be celebrating your achievements, and we look forward to your future successes and advancement in public health. It's my pleasure now to invite Professor David Bashai to say a few words to officiate our inaugural ceremony for the Zeta Alpha chapter's ceremony. Thank you, Professor Bashai.
Well, just so excited that this moment has come. It's long overdue that we have this chapter because we've had graduates worth recognizing ever since we were founded. The history of Delta Omega does go back to 1924 when two students at Johns Hopkins decided that they wanted to start recognizing excellence in public health. Edgar Eskeen and Claude Mitchell really started the very first Delta Omega chapter. It was founded, and then it's grown now to this international network that recognizes excellence. Excellence must be cherished, and we want to make it visible, and what better way than to bring it to our forum and to bestow this award. And it's just as vital 100 years ago as it is right now. We want to honor both the academic excellence and a commitment to the work of public health. So to earn this award, our candidates had to show that they were of utmost academic quality, combined with commitment to either volunteer work or work to improve the quality of life of the class. So they've mastered the science that we've been teaching them, as well as demonstrating the character required to be the future leaders we want them to be. So our Zeta Alpha chapter is going from 0 to 10, and we have our representatives here to get the award. I'm looking at our first candidates, and one thing I know that many of them have in common was sitting in the front row. These were the ones that were so eager to be good students that they sat in the front row. They also did this a lot. They also said, I want to talk, and they participated. That's what it takes. That's the sort of thing we're looking for. So congratulations to the awardees. It's a personal achievement, but it's also a responsibility. This is a lifelong honor for you and a lifelong calling for you to continue the leadership that was started during your class. You're joining a large group. You're part of a massive worldwide network, and now you've got that membership card to be members of Delta Omega around the world. So please exceed and fulfill our expectations to uphold the high standards that we've seen that you've exhibited. I want you to lead with integrity and to always challenge inequity, always move public health forward wherever you would serve. So on behalf of the school, I give you my warmest congratulations on this exceptional achievement.
Thank you, Professor Bashai. If you could remain on stage, thank you. I will now call each of our awardees that are present today, and they will come on stage, and Professor Bashai will hand your certificate and membership into the Zeta Alpha committee, and at the end we'll take a group photo. So, okay, so I will do the inaugural year by surname. Okay, we'll first with Mr. Chan Long Hin Timothy, who is our alumni and membership. Next is Dr. Hensika Hantana Patia. Next is Lee Franco, who I think has to send his apologies. So we will congratulate Franco on his achievement. Next is Dr. Elizabeth Oladasu. Next is Dr. Yana Tang. Thank you. Next is Mr. Ethan Duncap Wong. Next, we have Miss Dorothy Logzi Young. And last but not least, we have Miss Zoe Yip. Thank you. And if I could now ask all of our inductees that are present with us today to come back on stage, and we'll take a group photo, and that will conclude the induction ceremony for today. Thank you. Thank you, everyone. And this concludes the induction ceremony. Thank you.
Congratulations to all our inductees. Thank you, Dr. Wong, and thank you, Professor Bishai. Please be seated. This is the end of today's program. On behalf of the School of Public Health, I extend our deepest gratitude to all our speakers, panelists, award winners, and especially our engaged audience for making the Public Health Forum 2026 a resounding success. We hope today has sparked new ideas and collaborations. If you would like to take the shuttle bus to Kennedy Town MTR station, please make your way to main entrance of 5 Sassoon Road, the Jockey Club building for interdisciplinary research before 10:10 to catch the ride. Our staff will show the way. Thank you once again for participating in our forum. Have a pleasant day. Goodbye.